As we head into another school year, there are once again fears the colder months could cause a rise in COVID-19 cases.
That's right, but some health experts are more optimistic that this year will not be as bad. Millions of Americans are now eligible to receive an updated version of the COVID-19 booster shot. The modified doses specifically protect against newer variants of the virus.
Dr. Mark Klein is the physician-in-chief at the Children's Hospital in New Orleans. He joins us now for more. Doctor, welcome. Thanks very much for being with us. So how important is this updated booster as we head into another fall and winter season?
Well, I think it's key. The original vaccines have served us well. They have not been quite as effective at preventing infection as they have at preventing serious disease, hospitalizations, and deaths. But the virus has evolved, and these new BA4 and BA5 Omicron variants that are so dominant right now are not covered quite as well by the original vaccine as earlier strains were. And so this new bivalent vaccine has both what's called the ancestral strain coverage, the original virus from 2020, as well as these new variants that are causing us so much trouble across the United States today. So I would advise anyone who hasn't had a vaccine or a booster within the past 2 months to go out and get one of these new bivalent boosters.
Mm-hmm. And Dr. Klein, obviously it's after Labor Day, which means kids are back in the classroom. Many schools this year, Elaine and I were just talking about the ways our children's schools are dealing with the opening up of school this fall, but many schools seem to be doing away with most, if not all, COVID-19 restrictions and safety measures. Is the country at a point where it's safe to do that, or do you believe schools should keep certain rules in place?
Well, I'm a cautious person by nature, and many of us want to be done with COVID, but unfortunately, COVID is not done with us. We're still seeing 400 or 500 deaths a day from COVID across the United States, and children have not been spared. We all want our kids back in school, but the goal really is to keep them in school, not just to get them there, but then to keep them there, and that requires layered protections. There's no single thing that we can do to keep kids in school, but we need to make sure that teachers and other school staff have paid sick leave so that when they're ill with COVID, they can afford to take days off. We need to pay attention to ventilation in the school. Sometimes that's as simple as trying to open windows and doors to get cross ventilation, but improving air conditioning and heating systems also is important. We need to look at air filtration in the schools, these so-called HEPA filters, depending on the size of the classrooms. Social distancing is still important, particularly during meals. Outside is better than inside, so if kids can eat outdoors rather than indoors, that's key. And then high-quality masks, these K95 masks that are so good at filtering out COVID and vaccination, of course. So there are a number of things that schools should be doing, and I think it's a bit unfortunate that many have given up on mitigation because, we want kids in school, but we want them in school safely.
Yeah, absolutely.
You mentioned, Doctor, vaccinations, and the science and the data have shown that vaccines are the best way to protect against the most severe effects of the coronavirus, but only about 30% of children aged 5 to 11 are fully vaccinated. Dr. Klein, how do you think the country can change that and get more children vaccinated?
There's been so much misinformation and disinformation about COVID vaccines, and it's just unfortunate. I would really strongly encourage parents to talk to their pediatricians or their family doctors to get good, sound information and advice about the vaccines. I do understand the hesitancy many parents have felt. These are brand new vaccines. The technology was new. There have been concerns that the testing maybe wasn't as rigorous as it should have been. I've looked at all the data, and I'm convinced that these vaccines are very safe for children. And we know that they're highly effective. They may not prevent a child from becoming infected, but they will prevent serious disease, hospitalization, and death. They do that for children. They do that for adults. And so where my own grandchildren are concerned and where the kids of my coworkers are concerned, I have advised very strongly that they have their children vaccinated, and I haven't wavered on that. I've felt that way from the very beginning. And the longer we go and the more experience we get with these vaccines, the more strongly I feel about that.
It's important to hear your voice. Dr. Mark Klein, Physician-in-Chief at the Children's Hospital in New Orleans. Thanks very much, Dr. Klein, for sharing your insight with us.
Thank you.